This is continuation of the previous classes, okay? So we'll go to next now, and today is last for this topic. I'll start
Disturb
some.
sleep pattern.
Yes. So we'll move to next. This was regarding disturbed sleep pattern, right? Okay. Some specific nursing diagnosis I was telling about at the beginning also, specifically for child health nursing, like delayed growth and development, and some others I said. Can you tell me specifically for child health nursing? Can you just tell me one? Nursing diagnosis, delayed growth and development. Do you understand something? Have you seen this? Have you ever seen this in book? In book you have seen it. Have you encountered in clinical setup? Have you seen in the child delayed growth and development?
Yes, ma'am.
Yes, some of you have got na global developmental delay as
Yes,
nursing
ma'am.
care plan or something like that. So are you writing this nursing diagnosis? Are you able to formulate this nursing diagnosis for your client? The one who is getting global developmental delay as case study or presentation, I forgot. Someone got. Who is that person? Are you able to formulate this nursing diagnosis? Because there are on assessment basis there was findings were there. Did you formulate this? Malnutrition is there on the child. The child will be having risk for delayed growth and development. Yes or no? It will be there or not?
Yes, ma'am.
Yes. So diarrhea is there, frequent diarrhea, chronic diarrhea is there, malnutrition is there, frequent respiratory tract infection is there. So there will be risk for delayed growth and development. And some other conditions like that global developmental delay. The child was diagnosed as global developmental delay. That child must be having delayed growth and development. Okay. Just try to connect a little bit. Okay, that will be related to what? Separation from significant others. Separation from significant others means, what do you mean by this? What do you mean by this? The mother figure, the person who is taking care of the child, the primary caretaker. Okay, the main caretaker. If the child is separated from the primary caregiver, the child is likely to have not likely to have food, and child is likely to be emotionally disturbed, and that will influence the amount of food the child is able to ingest as well as digest. Okay, follow me. The young child who is separated from the mother, what are the problem might be finding? That child will refuse to have food, child will not ingest, child will have digestibility also will decrease, ingestibility also, the amount the child can ingest is also going to be decreased. Lack of environmental stimulation, the child who is left alone, not giving any kind of play, not being able to be among the people, if this kind of developmental stimulations are lacking on the child, there will be delayed growth and development. Social isolation, the child is not, if you do not allow the child to play with friends, do not allow to be among them, you are not allowing the child to interact with the friends, the development might be delayed. Sensory and motor delay, like that might be related to immobility, difficulty in positioning. Some problem might be there which leads to immobility in the child and even in difficulty in positioning. Neuromuscular impairment, some problem might be there because of that. Muscle problem, bone problem, this kind of problem is there because of that. The motor activities, the child is not able to move, not able to refine the gross motor as well as the fine motor activities. So that will cause delay in growth and development. So what you will observe on the child, inability to perform self care, Okay, self-control activities appropriate for age. The child who is able to do some kind of activities, you will see if growth and development delay is there, you will see that some activities the child was able to perform, but then now regressing. The child was able to feed by himself or herself, now the child is not able to feed by himself or herself because of either physical problem or some emotional problem. Okay, for the 6 month to 30 months old child, what you will see, the child will cry, child will scream, withdraw from others, the child remains inactive, child remains sad, and will show some regressive behavior. Okay, these are the observations you will make on the child. In case of 3 to 6 years old child, you will show that the child will throw temper tantrum, the child will cry like anything, child will refuse to have food, and the child will refuse to comply with the hospital schedule or the whatever routine you are doing, the routine activities you are doing, be it for the treatment or for some other purpose you are doing. So child will refuse to accept those activities, they will refuse to do it. 6 to 12 years, you will find that they will feel bored, they will feel isolated, they will have depression, they will have feeling of loneliness, because they are, in case of school age group, what happens, they are very much associated with their peer groups. You will see now what is happening, because you are in hostel, maybe you are not able to feel that problem, but then when the children are going to school and suddenly school is stopped for a long period of time, they are missing the friends. You will see they are missing the friends and they will be worried about that. So 12 to 18 years, in case of adolescent, what you will see, they may react with dependency, because they are in hospital. You feel that these activities I should not allow him to do, I should do for him, or parents think that I should do for him, he should not do him by himself or herself, he will do in a wrong way, or he will fall, something like that. This kind of dependency they may react with. So they may not be cooperative, they may withdraw from you, they may have loss of fear of loss of the peer, that they will miss the friends, they will not be friends with them anymore. So this kind of feelings they might be ventilating to you. Once they express this kind of things, that you will be thinking that there might be risk for this growth and developmental delay. So here you will see what will be the goal you will have to take. The child will exhibit age appropriate growth and development. How you define, how you get confirmation that the child's growth and development is appropriate for age? There are some physical parameters, there are some developmental screening. So you will be taking the physical parameters, you will be comparing with the normal one, you will be seeing that whether it is within the normal range or not. You prepare the growth chart, right? You have to do some developmental screening also, that this activity by this age the child should be able to do, but not able to do by this time. So there are some kind of screening tests you will have to compare. The child will meet age appropriate developmental milestones. You will see that whatever is appropriate for the age, for a maybe 1 year old infant, it is expected that the child should be able to take few steps, take few walks. Okay, the child is able to do that or not. So that target you have to take. What you will do as an intervention, what you will do, you will do assessment of growth and development, encourage the parents to be with the child continuously for consistent care. The word consistent care, what do you mean by this consistent care? Consistent care, see what happens in hospital, you will see that if there is a chronic illness, the child is hospitalized frequently, you will see that mother is not able to be with the child, maybe she has to attend one young child at home, or maybe some other reason the mother is not able to be with the child in the hospital, and other hand the child has to be repeatedly hospitalized, and most of the time the child is missing the mothers, and what is happening, whoever is available, the person is attending the child at home. So that consistency, if the mother is there, if the primary caretaker is there, the way she is going to take care of the child, there will be a consistency, because she will do the things in a similar way. She knows what the child likes, what the child does not like. So there will be consistency will be there. When that primary caretaker or the person who is taking care of continuously, frequently she has to replace by another person. So in that case, there will be no consistency of care. Am I clear? Am I clear?
Yes.
So there will be no consistency of care. So in that case, it is there will be risk that child will be having growth and developmental delays. So what you need to tell the same person, whenever possible. If not possible, you cannot say this you have to do. Preferably, you should ask the same person to be with the child, especially for the younger child, so that the growth and development is not interrupted. Provide visual, auditory, tactile stimulation. Also, music, toys, books, TV games, play with other children. Visual, auditory, and tactile stimulation. What happens? It is important even for a newborn baby. The mother have the eye contact with the baby. The mother speaks to the baby. The mother touches the baby. This is important for growth and development. Okay, the visual, auditory, and tactile stimulation. These stimulations should be given to the child for proper growth and development. Also, you know the importance of play. Why these things has to be given? Book, TV, games. You know very well. So provide activities based on age-related abilities. Okay, suppose to an infant, if you give some activities to draw or see the books, these kind of activities are not appropriate. So you have to give some age appropriate activities. Encourage independence as much as possible. Contact with peer for adolescents. So this is for the older age group. Like if it is an adolescent or if it is a school age child, you have to allow the child to talk over phone. That is also important. Okay, now because of lockdown, the children are at home. It is important that they talk with their friends. Now you can give video calls also, you can do. So this is important that you allow them to do. They feel connected by doing this. Advise parents of growth and development appropriate for child's age. What is the age? Depending upon the age, what advice you have to give? The anticipatory guidance, no? Age wise, when you are going to pediatric OPD, that time I was telling you that you take care of one infant and one toddler, and then you give the advice that is to be given to the parents. What is anticipated, what is necessary for the growth and development of the child. So that you are writing in your developmental assessment. Do you know? Are you aware of it? Or you forgot totally?
Yes.
Okay. Doing that or not? Advice to be given. If you have to give advice, first you should know. That's the thing. So exhibit in evaluation, what you will see that the child will exhibit growth and development, that will be age appropriate, and activities that will be age appropriate. What activities? For example, riding a cycle, that should be appropriate for which age group the child will be exhibiting those activities, as well as the milestones. You will see that milestones will be achieved. Okay, that you need to see in evaluation. Moving to the next, this is a very important for silent nursing. If you see that child is being hospitalized very frequently, there will be risk for this. So you have to, on the basis of your assessment, you can formulate this nursing diagnosis. Next, self-care deficit. This you are doing earlier also. So here, when you write the nursing care plan, self-care deficit, simply you write that self-care deficit. This is what self-care activity is the child is not able to perform. This might be bathing, dressing, grooming, feeding, toileting. So this will be related to impaired ability to perform activities of daily living, or it might be related to pain, or it might be related to discomfort. Impaired ability to perform activities of daily living may be related to some physical conditions like injury or maybe neuromuscular impairments. So this kind of when problem is there or pain may be there, discomfort may be there, because of that child may not be able to perform whatever the activity child is age appropriate and child was doing earlier. Okay, child was doing earlier and you need to decide that this is age appropriate or not. For that age group, the child can perform that particular kind of self-care activity or not, that you need to find out. So specifically you have to write what the child cannot do. It is not simply that self-care deficit, you just write like that. What kind of self-care activity the child is not able to perform, that you need to tell. What you will observe on the child: inability to wash body, inability to wash their own clothing, feeding self, not able to feed self, not able to position, not able to go to toilet. The child is very weak, fatigue, and maybe you will see that bed rest was imposed, but not, it is not necessary, or maybe it is necessary because of some conditions. The child has to be on bed rest and use of bedpan. These are the signs you can observe when the child is not able to perform the self-care activities. Now, what is your goal? The child will demonstrate increased ability to take care for the self. Okay. Intervention. Again, you will assess what are the activities the child was able to perform earlier before coming to hospital. The child was doing, but now the child is not able to do because the child is weak, because the child is having pain or maybe discomfort, or the child is too weak. What is it? You need to assess first. Then provide personal care for infant and small children. If it is an infant or toddler, you have to give the care. You cannot expect the child should be able to do everything. So you see, when you formulate this nursing diagnosis, what age group child it is. For an infant you cannot write this. For a small children you can write this. Maybe the child, a toddler, can feed himself or herself, sometimes can brush the teeth. So what activity is deficient, that you have to specify. Okay. Encourage parents to assist but to allow independence as condition permits. Like because you are thinking that even though the child can do, the parents are doing or you are doing, that will cause the child to be dependent on parents or maybe dependent on you. That is not your goal to do. So you, as much of the activity is permissible or the child can do, that you have to allow them to do by themselves. Praise the child for participation. If the child is able to do something, you praise. That works. Balance activities with rest, because it may be because of fatigue or weakness. So activity has to be balanced within the period of rest. It is not continuously that they will do the activities at one go. You have to balance with a period of rest in between. Instruct child and parents regarding difference in hospital, home in carrying out the activities of daily living, because I told you that they may show or they may tell you, they may resist to comply with the routine the hospital is having, but then you have to make them understand at home you are doing like this, like this, like that, but during that time, but here this is the rule. This is the time for this, have food, this is the time to take bath. This kind of things you have to make them understand. Ask parents to interpret child's need when the child is too young to talk, because that is why the consistency is important. The mother or the person who is taking care of the child continuously with the child, the person will know what the child is meaning. Maybe the other person will miss the clue. Got me? The other person is taking care, the other person may miss the clue. The person who is continuously with the child will understand. Yes? That is why consistency is important. So on evaluation, you will have to evaluate that what kind of activities earlier the child was not able to do. Now, with some degree of dependency, the child is able to do. What activities that you have to list out in the evaluation plan. It is not that the hygiene is maintained, or simply you will write that this is done, but what the child was able to perform now, that you have to specify. Moving to next, deficient diversional activity. I think this I told you in the previous class. This specifically you will find in child health nursing, deficient diversional activities. Do you remember now? I told in the previous class also. So deficient diversional activities, like the child will be when sickness is there, child will be having some kind of stress. Okay. So to divert from the stress, to manage that stress, you have to give some kind of activities. Why do you give play to the child when the child is in hospital? Tell. There are some limitations. The child cannot move out, child cannot go out, child cannot go out and play. So the child is confined to the bed, right? So in that case, the child needs some kind of activities where the child can get engaged with. Okay. So this is related to environmental lack of diversion, long-term hospitalization, because maybe fracture or maybe some other conditions are there, because of what for long time the child has to be in hospital. You fail to give some kind of activities where the child can get engaged with and can divert his mind. In hospital there is limited resource. Okay, actually in a pediatric ward there should be a place where the child should be able to go out and play. There should be a park or something like that. Some places should be there outdoor, some places should be there where child should be able to go out little bit and then little bit to play, and play area should be there, but this is not here. On top of that, whatever activities you can give to with the limited resources, whatever activities you can give, if it is age appropriate, some kind of activities you should be giving to the child just to divert his mind from the pain or the stress that is caused by the illness. Okay, what observation you will make on the child? The child will feel bored. If it is a old child, they might tell you that I am feeling very bored, I want to go home. Desire for something to do, maybe especially the hobbies or activities which cannot be done in hospital. They will tell you that I want to do this, I want to do that, I'm doing that at home, but I'm not able to do that. So they are going to express in front of you like that. So in that case you should feel that this is the problem the child is having. Now, what is the goal you will be taking? The child will engage in age appropriate diversional activities within limitation. So whatever activity is possible, you have to target to give to the child. On intervention, again, first thing you have to assess what limitation the child is having, what type of activities that can be allowed to the child, that you have to assess first. Okay, what kind of activities you can give? You cannot give you just to walk around the ward or maybe the block when once the child is having lower leg, some appliances are there. So you have to see what kind of activities you can give to him. Place with a child of same age. Why it is important to place the child of a same age? Can somebody tell me? Can anyone tell me why it is important?
Peer interaction.
Peer interaction. It is not exactly that. Actually, what? That is there, of course. The needs of a similar age group is same. It is similar. It is not same. It is similar, right? Yes or no? Like for an infant, for a toddler, the needs are same. Needs, their importance and things, the play activities they can engage with, these are same for a similar age group, so they get along with the same age group more. If you see, if you observe in a play group, if one is there that is older a bit, whereas among three or maybe more than that, but one two in the group it is elder to them, but most of them are of the younger age group, same similar age group, you will see that the older one, they sometimes dominate, or they used to have more fights among them. You will see that. Okay, if it is a similar age group, their thinking, their way of doing things are same, so they get along well more. So it is good if you place of similar age group child in the same block. It is good for them. Schedule rest and activity period. Because of fatigue, if this problem is there, then rest and activity period has to be scheduled. You have to schedule how long they will get engaged in some activities, how long they will take rest. Provide age appropriate play, including quiet play with games, TV reading, soft toys. Sometimes in some conditions you cannot give some plays where they have to be involved physically, or maybe some activities you cannot give the for what is not age appropriate, the child cannot perform. Suppose if you are giving a puzzle, the child is not able to solve it, the child is, instead of having some recreation, the child is going to get more exaggerated, child will be getting angry, so that will stimulate something else, like it is not for his stress relief, but it will give more stress on the other hand. Okay, so that is why it is important that you give the activities which is age appropriate. Sometimes you need to give some quiet play also, because the child cannot come out, child, you cannot overstimulate the child. Okay, encourage family members to play with the child. I don't think I have to explain this. School work for school going child. If it is a school going child, whatever school activities are there, you can still allow them to do in a hospital. Decrease boredom, child will participate in diversional activity. What kind of activity the child will get engaged with, that you need to specify here. Okay, on evaluation. Decrease boredom, that the child will maybe child will ventilate, the child will express, and child will engage in activities. Okay. Next, anxiety. That anxiety you may see in parents also, you may see on the child also. If it is old child also you will see, young child also you will see, but the presentation will be different. How the young child will present with the anxiety, and then how the old child will present. Change in, that might be related with change in health status, change in the environment. Having a child with deformity, the parents will have anxiety because of having a child with deformity or child delivered with a deformity. Need to provide complex long-term care. Okay, need to provide complex long-term care. Usually what the parents has to do, it is not that the child has parents has to take care of a child who is having maybe attention deficit hyperactivity disorder, which is very difficult. So this kind of problem is there, that is a long-term care needed. In that case, role change. Role change, what the mother is doing, sometimes the father has to do, what father is doing, sometimes the mother has to do. Because of this role change also, they might be having, parents might be having the anxiety. So on child, what you will observe, if it is a young child, you will see, old child also you might see restlessness, express concern over procedure, what they are going to do, they are going to give me injection, they are going to do this, they are going to do that. Loss of control, this loss of control I think I have explained earlier. Still we are going to have one more class, age appropriate, that will be again. Okay, loss of control, that I'll explain to you later on again. Clinging to parents, refusal to interact with the staff, signs and vital signs, these things you will see on the child. On parents you might see again the restlessness, you may see blame themselves for child's illness, they blame themselves. Overburden due to financial involvement, they are not able to carry out with that. So in that case, what is your goal? Child's parents will experience decreased anxiety, that is your goal. What intervention you will be taking? Assess the level of understanding. If it is a young child, you have to assess the level of understanding, how much the child can understand. If it is an older child, they can understand something, but it is a younger child, may not understand many things, you may speak. So you have to first assess what, because to relieve anxiety, the important thing you need to do is you have to encourage them to speak what is their more concern. You have to allow them to speak, you have to listen to them carefully, and that has to be individualized. It is not that everyone is telling something and then you are giving a judgmental comment after that. It is not like that. You have to listen to them individually, what they are saying, you have to listen carefully. Orient to the hospital schedule setup and staff. This is another important thing to reduce the anxiety on the parents as well as the child also. Involve parents in the child care. Once you involve them in care, what happens? They feel that I can do this. Okay, they feel that I can do this, and they feel confidence, and they feel happy finally doing something for the child. Okay, that is why it is very important that you involve them in the care of the child, because they may be having a negative attitude, or maybe they may be having fear to do some procedure or give care to the child. Once you explain to them, you ask them to be involved, you involve them, you teach them how to do this. Once they get involved in this care, they feel satisfied, and that will decrease their anxiety. Okay, allow parents to be with the child maximum time possible. You should be asking the parents to be with the child. Then play, the kind of play you should be giving to the child. This is for the child, whatever is appropriate. Provide quiet environment, decrease stimuli causing anxiety. Okay, like some kind of irritating, some sounds, some noises are there in the environment, that also increases the anxiety level. So you should be trying to control those in the environment. Support the child during the procedure. So here, how you support the child during the procedure? That first thing is, you should be allowing the parents to be with the child. You should be giving proper explanation to the child. You are not going to tell lie that I'm going to give you injection, it is not going to give pain. This kind of support you cannot give. You have to say that pain will be there, little bit of pain will be there, but this will disappear. This kind of things you can say. Okay, inform ahead about treatment and procedure. They will be prepared, mentally prepared, what will be going on. Once you inform, when you prepare them, it will help them to reduce their anxiety. So on evaluation, if it is a old child, they will say that I'm not scared now, I know what is to be done now, what will happen, I know. Like that, the child will express. That child will directly not say my anxiety is reduced. Okay, the child will say, you will see that child is calm and quiet now, and child understands what you have spoken to, and then child knows about the what is the treatment procedure going on. Okay, that is in case of a old child. And similarly, the young child, if it is a young child, the behavior associated with decreased anxiety, you will be observing that. What you will observe, the child is no longer clinging to the parents, the facial features are relaxed. For parents, they will verbalize understanding of procedure, the care of child, and the importance of play. These things they will understand, and they might verbalize that. So I think you have taken all the screenshots. I do not have to give you again, but this is not the end of this. Okay, even though I have finished with this, I'm not going to give any more for this. You have to read some interventions, how they formulate the interventions, how they formulate the goals, these things, what kind of nursing diagnosis, how they formulate the goal, how they formulate the nursing interventions. This you have to go through books also a little bit. Okay, this is not enough whatever I have given. This is only the basic things I have given to you, just to have a guidance, just to have a guide for your care plans when you write. Okay, only for that. Much addition you can do, and you are expected to do that. Go through the books, read it. Now you are not allowed to come to library, but once you are allowed, I think now so much of activity you are not doing, assignments and all, so you try to read the books little bit, refine your knowledge, okay, regarding this. That's okay.
Yes,
See
ma'am.
you. Thank you so
See
much.
you.